Hi everyone, this is Dr. Praveen here. Today I would like to speak about the H. pylori infection. Most of the people who underwent a endoscopic procedure, they may be knowing something about the H. pylori. So this H. pylori is a bacteria which is present in our stomach, which is said to be cause for gastritis, gastric carcinoma means cancers of the stomach, and the malt lymphoid carcinoma or maltomas. So H. pylori is the gram-negative bacteria. As we classify bacteria into gram-positive and gram-negative based on the cell wall of the bacteria, this is a gram-negative bacteria, and it never enters into the systemic circulation. So, if cellulitis happens, if there is a pin prick happens into your foot, so there will be infection at the localized area, then it is spread into the across the body. So that is a systemic entry, localized entry, then into the systemic entry. But H. pylori only colonize on the stomach mucosa. It never enter into the other part of the body. It never enter into the systemic circulation. And the main important part, the beauty of this organism is even it survive in the acidic media. As you know, the stomach is having HCl, hydrochloric acid. In spite of that acidic media, the organism survive in that atmosphere. This is the reason when it is discovered that the H. pylori is the cause for gastritis, the many scientists refused to accept this because the organisms won't survive in the acid media, but it has a capability of producing urease which convert the urea into ammonia. Ammonia is the base, and it create a base media surrounding its colonization. It has the capacity of turning that acidic media into the alkaline media. Coming into the epidemiology, in USA 50% of the population has H. pylori infection. 50% surveillance is seen in 60-year-old people, 20% in 30-year, and 10% of the surveillance of the infection is seen in the children. In countries like India, 80% of the surveillance is seen in common means young adults. Humans are the important reservoirs for this infection, and this gets transmitted by the fecal-oral route or fecal-fecal route. So contaminated hand, contaminated water, contaminated food is the main source of infection. There are some factors which can increase the risk of cancer when there is a H infection is there. Those are said to be a precipitating factors like smoking, taking salt-rich food, and not taking of antioxidants. These are the precipitating factors. Whenever there is a H. pylori infection is there, that may turn into the adenocarcinoma or the maltomas. So food like which are rich in ascorbic acid, that is vitamin C, and antioxidant, that will reduce the risk of getting cancers even though there is a H. pylori infection is there. Antral predominant, antrum is the lower part of the stomach. If there is an inflammation in the antral region, so the chances of getting that inflammation into a ulcer formation or duodenal ulcer formation, that is that is common in case of H. pylori infections. What it does, the H. pylori diminishes a somatostatin producing these cells, hence the acid secretion will get increased, and that acidic inflammation turn into a ulceration over a period of time. So this is how the H. pylori causes a ulceration, and that persisting ulceration may cause the metaplasia, and later on that may turn into the cancerous changes. So as I told, the surveillance is 60%, means 50% in the 60 age group. So all the people won't get any symptoms, or the all the people H. pylori won't act. Only in 15 to 20% of the peoples get the symptoms of gastritis, and they may turn long-standing exposure, long-standing taking the treatment for H. pylori may turn into carcinomas, means cancerous changes. 60% of stomach cancers are associated, more than 60% of the stomach cancers are associated with the H. pylori, more than 80% of the duodenal cancers are associated with the H. pylori. What are the diagnostic criteria? The most reliable diagnosis is done by the endoscopy only, upper GI endoscopy. So, there are some other indirect methods like breath test, urea breath test and stool antibodies. So, even though if there is a previous infection for which the person has already developed the antibodies, so those are the misguiding things. Even though if they at present if you do not have any H. pylori infection, then also it may show the presence of antibodies which indicate either present infection or a previous infection, but that can be easily we can make out by doing the endoscopy. Endoscopy is the most reliable investigation to identify the H. pylori. So, in which we come to know the active infection, active presence of the infection, and as well as the damage on the findings of the gastric mucosa, esophageal mucosa and duodenal mucosas. Coming to the treatment part, a 14 days treatment is sufficient for this, and afterwards it need to be followed up, and the upper GI endoscopy has to be repeated after 3 months to make sure that the infection got eradicated. So, there are 3 drug regimens comes and 4 drug regimens comes, single drug regimens, dual drug regimens. There are different method of treating the H. pylori. So, that is I am not going to discuss here. So, just for the briefing, omeprazole, clarithromycin and metronidazole are the most commonly used triple drug regimen for the duration of 14 days. So, this is all about the H. pylori. If you have any doubts regarding the H. pylori infection, you can write in the comment box. I will try to answer for that. Thanks for watching the video.